When you hurt your back, your body knows what to do. It launches an acute inflammatory healing response, sending blood flow, immune cells, and repair signals to the injured area. That's your body actively trying to fix the problem. And for many people, it works. The pain fades, healing happens. But for millions of others, that healing never fully completes. The pain lingers. Weeks become months, months become years, and something very different begins to happen inside the spine. With chronic back pain, the joint tissue around the spine has undergone a fundamental change. Over time, under persistent stress and without proper healing, the supportive tissue in and around the spinal joints becomes fibrotic, a type of internal scarring. This tissue thickens, stiffens, and loses its healthy function. The joints degenerate. At the same time, increased pressure within the spinal discs blocks the essential flow of fluid, nutrients, and oxygen into the disc. Without this nourishment, the disc begins to dry out, a process called disc desiccation. It loses height and structural integrity. The outer wall weakens and breaks down. The result is a cycle of progressive deterioration, and it gives rise to some of the most common and most debilitating spinal conditions. Degenerative disc disease, which is essentially osteoarthritis of the spine, herniated discs, bulging discs, sciatica, spinal stenosis. These are not isolated events. They are the downstream consequences of tissue that has been changing for years. For decades, these conditions have been considered difficult, if not impossible, to truly resolve. And the limitations of traditional treatments help explain why. Medications and injections can reduce symptoms temporarily, but they don't touch the fibrotic tissue or restore the disc. Physical therapy and chiropractic care provide value, but they have real limitations when the underlying tissue is degenerated and scarred. And surgery, while sometimes necessary, carries mixed results. It often addresses only part of the problem, leaves the underlying degeneration intact, or creates new scar tissue that can become a secondary source of pain and dysfunction. The result? Patients cycle through treatments, get temporary relief, and find themselves right back where they started, or worse. But now all of that has changed. Advances in technology and treatment approaches have opened a new door. At Capital Region Integrative Health, we have developed the Novo-Therapeutic Protocol for spine rehydration and rejuvenation, a non-surgical, non-invasive, specialized approach that for the first time allows us to genuinely get to the root cause of these chronic spinal problems. Our protocol uses advanced technologies to break down the fibrotic, scarring tissue that is built up in and around the spinal joints. It stimulates collagen regeneration, activates the body's own stem cells, and drives deep cellular repair. Critically, it also works to decompress intradiscal pressure and restore the fluid exchange that rehydrates and rejuvenates the disc from within. Pain signaling is reduced at the source, and spinal mobility and function progressively return. Because we are now able to address the root cause, not just the symptoms, our patients are experiencing results that were simply not possible before. They are healing, they are feeling better, and they are returning to the active lives they once had, hiking with family, playing with grandchildren, traveling, doing the things that make life worth living. If you are living with chronic back pain and you are ready to find out if there is a real solution for you, we want to hear from you. Contact Capital Region Integrative Health today to schedule a consultation and find out if you are a candidate for the Novo-Therapeutic Protocol for spine rehydration and rejuvenation. It's time to stop managing the pain and start healing it. Get your life back.